The Ontario government is reminding individuals that starting today, all adults aged 18 and over are eligible to receive the bivalent booster dose for COVID-19. But what exactly makes this booster different? I caught up with Dr. Oda, Halton Regions Associate Medical Officer of Health, to find out.
So, as you've likely heard, the COVID-19 virus has changed over time. And we have the most common strain right now is currently the Omicron variant. And so, this bivalent vaccine now contains a specific strain, it now protects against a specific strain of the virus, the Omicron BA1 variant. And it also provides good protection against the more common BA4 and BA5 variants that are circulating right now. So the real hope is that if a person gets boosted with this bivalent vaccine, that they'll have that bit of extra protection against what's currently circulating.
So, if people out there are like me who were really keen on getting their fourth shot, which I did in August, and now this one comes out, what do I do? What do we all do who already did get their fourth booster?
Yeah. Well, first off, thank you very much for getting your second booster for boosting your immunity that time. People who were recently boosted can get their next dose, the bivalent booster, in as little as 3 months after their last dose. The recommended interval is about 6 months. However, we the one of the things that the National Advisory Committee on Immunization said is that you may want to do that shorter interval of 3 months if you're going into a period of time when there's increased transmission. And we know, given our experience in 2020 and in 2021, that somewhere in the fall we are going to start to see that increase. We don't know exactly when, but we are starting to see some levels in our wastewater go up. We're starting to see a few more cases. So it's a little bit like, when do you get your winter tires on? You know you're going to need to do it, and you don't want to leave it too late. And so if you're past that 3 months, and you've got some time, go now. And certainly if you're past the 6 months since your last dose, go out and get that done now.
So it's good news that this bivalent vaccine is coming out and everyone over the age of 18 can get it. When do you think kids will be able to get it younger than 18?
That's a really good question. So right now, the Moderna product is the only bivalent vaccine approved in Canada, and it's only authorized for people 18 and older. So that's why we don't see anything available yet for people younger. There is a recommendation for children 12 to 17 who are immunocompromised or immunosuppressed to go out and seek that bivalent, to get that bivalent dose as well, very similarly to people who are older. And then the other thing I will just add is that children 5 to 11 currently can get a booster dose if it's been 6 months since their last dose. However, that would be the pediatric product, which is currently a monovalent product.
Now, a lot of people just have a COVID hangover and just are not interested in getting their booster shots. I know it's going into cold and flu season. What do you tell people out there that are just not that interested?
Yeah, it's really difficult. I know people are really eager to move on, and I think we can start thinking of this as very similar to getting ready for winter, to getting ready for the fall. Like I said, you do things like, put on your winter tires, you get your winter clothes out of your closet and put away your summer clothes. This will become part of getting ready for the flu and cold season. We'll be doing something like getting a COVID-19 booster. This is probably the best way to keep COVID from bugging you during the winter, is protecting yourself through vaccination.
And of course, people can get a COVID shot and they can also get a flu shot this fall.
That's correct. Yep. Currently, the COVID-19 booster is available now. So again, if you're past your 3 months, certainly if you're past your 6 months, I would go out and get that now. I wouldn't wait for the flu vaccine to come out. The flu vaccine usually doesn't become available for everybody in the population until the very beginning of November, maybe the last week of October. And so COVID, unlike flu, does seem to be occurring a little bit earlier in the fall, given the experience the last couple of years.
And what is the best way to book in the Halton region your COVID booster?
Yep, so you can go to our website, halton.ca/COVID vaccines, and you'll get a whole list of all the clinics that we're running. We have lots of appointments ready to go. Unlike the provincial system, you can book online if it's earlier than those 6 months. As long as you're past the 3 months, you can book online through our easy to use booking form.